Hi, this is Dr. Divya Sundaresh. I'm an oculoplasty surgeon. I am a surgeon from Bangalore and I also work at Zamindar's eyes. Droopy eyelids are when the person complains of sagging of the upper eyelids. Now, this can be either because the upper eyelid muscle is weak or because there's excessive skin causing baggy upper eyelids. These two conditions need to be differentiated. There are a number of causes for this and they need to be ruled out before any treatment can be done. So normally droopy eyelids are commonly seen as we age. Now as we age, the levator muscle, that is the muscle that elevates the eyelid or opens the eye, is becoming weak and stretched. Now this is a natural aging process resulting in droopy eyelids as we grow older. In children, droopy eyelids can be present since birth. This is a congenital ptosis. Here, the levator muscle is not developed properly and hence the eyelid does not elevate. Now, in children, it's very important that we address it, especially if it's blocking the visual axis, and that time it can hamper their visual development. So, hence, you need to see the doctor quickly if your child has a droopy eyelid. Now, when it comes to adults, a traumatic cause can also be there, especially after road traffic accident when they have facial injuries or facial fractures. It can result in the upper eyelid to droop. Now, we can also rule out two other important conditions where it can also be because of a nerve palsy, like the third nerve palsy, where you have a neurogenic cause, and you can also have a myogenic cause or a generalized condition of the body like myasthenia gravis or myotonic dystrophy, where we need to rule out these causes which have a generalized effect on the body. Also can present as droopy eyelid. Commonly, various etiological factors or the various causes, most common risk factor is just old age. The others can also be if they're susceptible to develop any cerebrovascular accidents, thus resulting in nerve palsy, or they have a history of myogenic disorders or a family history of myogenic disorders, which also can result in droopy eyelids. So generally the patient will have a very tired look. They can have headaches because of constant strain on the eyebrows to elevate the eyelids. This can cause asthenopic symptoms as we call it. Then they can also have dry eyes because they're constantly rubbing their eyes. They can have a decreased field of vision because the eyelid does not open adequately. This also makes it difficult to drive at night because it hampers their vision. When we have a patient who has droopy eyelids, we need to rule out any of the organic causes like mentioned, the neurogenic or the myogenic causes. So this requires certain number of blood tests and investigations like an MRI to rule out these causes. When it is an old age problem where the levator muscle is lax, then these tests are generally negative and we can proceed with the treatment. In children as well, once we rule out any other cause, we can proceed with the surgical treatment. Droopy eyelids are treated mainly by the surgical methods. Now, when the levator muscle is weak, to a certain extent, it can be tightened and thus elevate the eyelids. Now, this is done through a small lid crease incision where incision is hidden and also the scar formation helps to keep both the eyes symmetric. When the levator muscle is too weak, then we might have to elevate the eyelids by suspending it from the forehead muscle, the frontalis muscle. This is called the frontalis sling surgery.